able to attend the National Community Pharmacy Association, or NCPA, their convention, with the documentary producers from a movie about pharmacy issues that would be called Would You Like Shots with That? As they followed me around for a patient's perspective and interviewed many pharmacists, they were able to capture many truth-telling stories and moments that will certainly point out the issues with pharmacy today. NCPA has long been an association that advocates on behalf of community pharmacies. Their advocacy does help patients like my son. Sadly, I believe that there are some at NCPA that don't know who I am or why I became an advocate. At the meeting, I was shocked to find a Pharmaceutical Care Management Association lobbyist, that's PCMA. They were at the Community Pharmacy Convention. PCMA is a lobbyist association for pharmacy benefit managers, or PBMs, that force many to their own pharmacies, such as Express Scripts, Optum RX, and CVS Caremark. After finding out that he was there, I decided to track him down. I realized this was a lobbyist I met in Oklahoma at a legislative meeting. He was speaking on behalf of PCMA and against patient choice of pharmacy. I walked into the hall and I found him and I said, "What are you doing here?" And with a shaky voice, after he realized who I was, he would claim that he was trying to learn how PCMA could help community pharmacies. I don't believe him. I was informed that he was sitting in meetings that involved direct contracting, which may include contracting directly with an entity and cutting out the PBMs. I questioned him for 20 minutes. Our conversation would end after I asked if he would be okay if his own child had cancer and the tumor was rapidly growing in their body, but he couldn't use his local pharmacy or hospital pharmacy to get the medication that his child relied on the same day. Instead, he would be forced to an insurance or PBM-owned mail-order pharmacy that would take weeks or months before his child could start the life-saving treatment as the tumor grew in his child's body. Sadly, I have more than one of these stories from parents and caregivers. Apparently, the lobbyist would be fine with allowing the tumor to grow inside of his child, as all he would say is the same quote that he would tell our legislators, as he stated he supports whatever is affordable and accessible. I reminded him that PBM's pharmacies are neither affordable or accessible, as the pharmacies have 1-star ratings on most consumer report sites and have been found price gouging several patients and taxpayers in several states by millions of dollars. Sometimes this even occurs under the disguise of a lower copay. I found with a lower copay that the pharmacy we were steered to reimbursed their own pharmacy 10 times more than our local pharmacy behind the curtain. He was quick to blame the poor contracting decisions made by the federal government and employers, but placed no blame on his own association, the PBMs, or the insurance companies that create these types of contracts with these loopholes in the first place. Next, I was able to shake the hand of Chair of the Federal Trade Commission, FTC, Lena Khan, who was speaking at the event. The FTC is tasked with protecting the public from deceptive or unfair business practices and unfair methods of competition through law enforcement, advocacy, research, and education. Chairman Khan gives me a lot of hope. She reminded that FTC is allowing the public to speak monthly about issues. Please, if you can, share your stories and concerns about being forced to mail order or other pharmacy issues in these public meetings, especially when they're directly linked to the monopolization of the industry. And most importantly, Chairman Khan reminded the crowd that FTC is limited on what they can do. So it's still critical that our representatives hear from us and that we push them to pass legislation that will protect us. Please put political division aside and reach out to your legislators to demand protection from the many unethical practices of PBMs. In order to save pharmacy for patients like my son, we need patient protections from delays and improper temperature control that many face with mail order. We need our pharmacies to be paid above their cost of medications, so they will stay open so we can have the much needed patient choice of pharmacy. Currently, the PBMs and insurance companies make more money than the pharmacist filling prescriptions. Many insurance companies or pharmacy benefit managers are purposefully reimbursing their competitors' pharmacies so low that they end in the red, creating pharmacy closures. Chain pharmacies need to be mandated to be staffed properly and provided with the time to serve their patients. And when they're unable, it shouldn't be the pharmacies that are held accountable or the pharmacist, but it should be the upper management, the CEOs, the administrators, not the pharmacists when they are working extremely hard to service them. So these are issues that could be corrected with legislation. When Chairman Khan was scheduled to speak, I wanted to sit closely to the front row if possible. I wondered if it was okay to sit in the several empty seats up front. I asked a pharmacy friend, and he said that it would be okay. I made my way to the front. I looked beside me, and the guy I just so happened to sit next to looked at me. I glared back at him. We knew each other, but we just couldn't figure out how. Then I realized that this was a student that was part of the Oklahoma study that was revealed last month at the NABP meeting in Oklahoma that showed that 80% of packages are reaching temperatures deemed unsafe by the FDA standards, as the FDA does not regulate mail-order pharmacy. The study was inspired by Wesley's story. The last time we saw each other, I had curly hair and he had his hair styled differently. Once we noticed who we were to each other, we gave each other a hug and he introduced me to his colleagues. Seeing these hero students sitting beside me, I felt as though I was right where I was supposed to be. As I fight to save pharmacy access for patients like my son, there are many times that I'm reminded that I'm not wealthy. I don't have a front row seat to our legislators like PCMA lobbyists, such as the lobbyist I met in the hallway, who was a senior vice president of government affairs for the state of Oklahoma. He already has his foot in the door with legislators. Our nonprofit is still not funded, so I'm still working more than full-time, and all of my work for the nonprofit and as an advocate is volunteer. As I struggle to even have the time to write this update, I feel the unfairness, but I focus on what we do have. What we do have is our voice, and the voices of many other patients, patient advocates, pharmacists and their staff, physicians, and many great associations such as Pharmacists United for Truth and Transparency. And they're all uniting together. Each one has the power, each person has the power within their voice to make a difference when they share their story and demand better for legislators. Please continue to speak to your legislators and learn more about these issues. Thank you.